This capsule is story time. I'll be telling you some stories. True stories. The first story is of a lady who comes to my clinic and tells me that she has irregular periods. And that's it. That's it. No further comments or clarifications or anything. She's just got irregular periods. So coming to my second story, a young lady comes along and says she's missed her periods. She should have got her periods sometime last week. And when pressed to tell me when was her last period, she wouldn't know that, she doesn't remember, but it was probably sometime last month, and then she'll have a discussion with her partner about did she get her periods before that particular function or something like that, and then ultimately they'll come to me with a date which is approximately plus or minus 10 days. Yeah, these stories are amusing, isn't it? Yeah, they are quite amusing, and probably in most of the cases it doesn't make that much of a difference. So I'll come to the third story. There's a young lady who was not keeping track of her periods. She was married for the last 6 months. She was keen to get pregnant, and unfortunately she had a fall, and she went to the local casualty where they had to go and get a CT scan done, and about 2 months later they figured out that actually she was pregnant when they got the CT scan done. But she didn't know she was pregnant, and she did not know she was pregnant because she was not keeping track of her periods. So the moral of all those stories are that you need to keep track of your periods. You need to keep what is called a menstrual diary. And this is something we teach in adolescent education classes, in which we teach all our young girls that as soon as you hit puberty, you need to start keeping a menstrual diary. So what do you need in a menstrual diary? One, I need to know when was your first day of your last menstrual period. So write down when did your period start, what day and date of that first day of your menstrual period. This is going to be the most important thing. You need to document not when you were going to get your periods, but actually when did you get your last period. Then you need to write when did that period finish, how many days was the flow. You need to write how much was the flow. So that you can do by number of menstrual cups you used, or the number of pads you used, or some vague assessment. It's all right, but at least you can write down maybe graphically. If it's a little blood, maybe 1 plus. If it's a lot of blood, maybe 5 plus, something like that. So it will give us a clue about how much of bleeding you have. The fourth parameter is pain. So we would like to know, do you have pain when you get your periods? Did you have pain before you got your periods? Did the pain persist after your periods start? What is the type of pain? What is the severity of pain? We also would like to know whether you had taken any hormones or any tablets, or you had any illness or any surgery which may sort of shake up your period dates. We'd also like to know whether you had any bleeding in between the cycles, so what we call intermenstrual bleeding. So you can keep a menstrual diary by just writing it out in a piece of paper, or in a diary, or in a calendar, or in an app. In rural areas where illiteracy is high, we've actually used a string of beads, colored beads, white for no bleeding, red for bleeding. So if you track your period dates correctly, you track your fertility. And that is the first step of fertility control, either to get pregnant or not to get pregnant. There is something called a rule of 10. And the rule of 10 means that any tablet which is not absolutely mandatory to be given in that particular time, wait for the first 10 days of her periods. That is in any girl who's reproductively active. What you have to give, you have to give. So if you got, say, malaria, you have to give anti-malarial drugs. We can't wait for the first 10 days of your periods, obviously. But if the tablet is not absolutely mandatory, we would always prefer to give it in the first 10 days of her periods. That is true even for CT scans. That's also true for X-rays and the like. Unless of course it's an emergency, but in an emergency you still have to tell the X-ray technicians that, listen, I got my periods on this particular date, and they will help you by putting a lead shield on your tummy so that if at all you have a pregnancy, it will not hurt it. So the next time you need to meet your gynecologist, why not make his day by bringing your diary along and see him smile. Bye.